When the coronavirus first hit Africa, many observers feared the continent's overall poor healthcare would result in massive casualties. Many Africans are high risk for severe infection due to diabetes and tuberculosis, both too common on the continent. But Africans make up just a fraction of COVID's global death toll.
One good thing for Africa is that the young population it's kind of an advantage for the continent, because even from the statistics for COVID, we have seen that the young people are presenting, majority of them really asymptomatic or mild symptoms. And so as a result, at the beginning of the first 2-3 waves, we see the reported cases are not so much in terms of people that end up in the hospital.
But vaccine inequities have left Africa vulnerable, with less than 10% of the population vaccinated. While vaccine shipments to Africa have increased in 2021, distribution remains a challenge. The WHO cites poor access to vaccines as causing virus variants and new waves of infections.
The population is susceptible, of course. The virus has an opportunity to spread and mutate very well. But we need more to cover more populations in Africa so that we can reduce the risks of all this evolution of variants.
Western nations' travel bans over the Omicron variant have worsened the pandemic's economic damage, as many African countries rely on foreign tourists. In South Africa, the continent's worst hit by the pandemic, unemployment is near 35%. Frustrations exploded in July as political protests turned into widespread riots and looting.
The politics of hunger and desperation has really come to the fore. And by July last year, as we started seeing an opening up of restrictions or less restrictions, we recorded on the Public Violence Monitor that is run by the Institute for Security Studies the highest number of protests ever since we started monitoring protests in 2013. So people were desperate to be heard and desperate for help.
After the worst recession in decades, the African Development Bank projects an economic rebound for Southern Africa in 2022. But the ABD says that recovery also hinges on successful vaccination programs. Linda Givetash for VOA News, Johannesburg.